I'm a nurse practitioner here at St. Elizabeth's in Youngstown, and the whole Obamacare situation has cost us a lot of money, a lot of time, a lot of changes have been made. I'm extremely concerned when I hear things coming out of Congress saying we're going to repeal Obamacare, repeal. You can't just walk in the first day of office and say, we're repealing every word of Obamacare. We have spent millions and millions of dollars making changes to accommodate the regulations that came along with Obamacare, not necessarily to the good, but how do we make adjustments to provide care for our aging population without rationing care, pay for that care, and not kill our industry? I don't know how many days I've told my very patient, loving husband, they're killing us. They are killing us. We've had extremely talented physicians and surgeons leave the business, leave their practices. They're done. I'm out of here. They're killing us. What would John Kasich do?
Well, I'm glad that you asked such an easy question. Well, look, first of all, I don't know about all the millions and millions being spent. Here's what I know the problem with Obamacare is. Healthcare costs are going through the roof. The whole purpose of it was to slow healthcare costs down, and healthcare costs are going through the roof, number one. So it failed at that level. Number two, we want people to have health insurance, but the cost of health insurance has gone up by an average of 80% in Ohio. So number two, it's become less affordable. Number three, I was with a lady somewhere the other day. I know where it was. It was in Lima at this pallet place, and she has 49 employees. She said she's not hiring the 50th because she doesn't want to get caught in all this stuff. So now we've hurt small businesses' ability to expand because they don't want to get tangled up in all these things. So what do we do about it? Well, there is a provision in that law that I think is a good provision, and I'll tell you what it is. No one should be unable to get health insurance because they have a pre-existing condition. Nobody in America should ever lose their house, their savings, or anything else because they can't get health insurance or they get sick. Okay? I mean, that'd be crazy, right? So, I believe we can take some of the federal resources and combine them. This is what we would absolutely do in this state. We would take federal resources and combine it with Medicaid, and we would cover the working poor. Because right now they get subsidies, and they've got to can't just have millions of Americans without health insurance. But let me also tell you that we need a fundamental change in medicine. Now, I don't know about all the healthcare centers here, but I will tell the business people who are here, we need to have total transparency. How are hospitals doing? What are their prices? What is their quality? You can't answer that question for me, Tom. You can't tell me what they charge because you don't know. Do you know what physicians are charging? Do you know what their success rate is? You don't know. So what we need to do is we need to have complete transparency. And we need to find out who's the high chargers with quality, who's the low chargers with quality. And what's interesting is just because you charge a lot doesn't mean you get high quality. You know, one of the things they say, you know, it's very dangerous to go into the hospital because you'll get an infection or you'll catch something else. We need to reduce the amount of medical mistakes. We need to know what's the readmission rate. When you come out, do you have to go back in because they didn't fix you? We need to know all of this. And what we are about to do in our state, which is what I want to do in the country, is for people who have high quality at low prices, I want to give them a financial reward for doing that. When we have a primary care doctor, and you know, primary care physicians don't make much money. There are a lot of people that go into medicine and they avoid being a primary care doctor because they don't get paid much. But if the primary care doctor keeps us healthy and with high quality and lower prices below what the normal expectation is, we will give he or she a financial reward. This would have the impact of bringing down healthcare costs, of having all of us involved in determining the quality, giving us more ability to choose, and I believe would lead us away from the problem of rationing. And the problem of rationing is somebody who knows somebody gets something, and somebody who doesn't know anybody gets nothing. And so we don't want to be in that environment, and I believe that the plan that I'm talking about, which we are actually enacting in this state, this is not theory. We hear a lot of theories out there about, well, we're going to do this, we're going to do that. We have to make sure these things work, because we're talking about our health and the health of our families. And I believe over time, this is the way in which to get it done. We have worked on this with all the people that provide the coverage, the insurance. We've worked with this with the major hospital operations, including the Cleveland Clinic. And I know that this is the right way to go, Rob. And